Gutierrez, I believe you're next in line.
Thank you, Mr. Chairman. Let me just first say I thank all of the men and women that work at Planned Parenthood. I thank them for the incredible service that they offer millions of women who would otherwise go without the kind of considerate, compassionate, understanding service that I believe that women in this country need and that isn't being offered in other venues. I thank them because just this last year, there's 500,000 fewer pregnancies. That's a way to stop abortions. This shouldn't be a question of who's for abortion, who's against. Everybody's against abortion. But how do you stop abortions? How do you allow everyone to live in the 21st century? How do you allow women to live freely in the 21st century if they're not in charge of their reproductive system? I think that's key, and I think part of what is going on here is that Planned Parenthood has a direct association with the pill, with contraception, and that fight continues to go on. We shouldn't have that fight. The vast majority of women in America and across the world that have access take birth control. I'm certainly not going to judge my wife. We have two beautiful daughters. They're 8 years apart. Why? Because we had access to birth control. We had access to birth control so that we could determine when it was we were going to have children, and we could raise those children. We could raise those children to be productive citizens of our society. You know, when you show me that Planned Parenthood actually was selling body parts, then we're going to have a conversation about the future of Planned Parenthood. Nobody's shown that. And let's make it very, very clear. Medical advances in vaccines for polio, measles, rubella, vaccines against drugs, neurological disorders, immune deficiency, cancer, Parkinson's. We need to continue to have medical research. And part of that medical research is because there is the ability to access the fetal tissues. And that there isn't profitability in it, and nobody's shown there's profitability in it. But there needs to be a way that we have medical research in this country. And so I just want to say thank you to all of the women and the men and all of those that labor in our healthcare delivery system across this country, and especially those who would provide that to women. 80% of the clients receive birth control services. That's 516,000 unintended pregnancies annually. I want you to think about that. And I want you to think about the estimated 1 out of 5 women in the United States has visited a Planned Parenthood health center at least once in her life. 20% of the women in this country. Of course, some people don't want them to visit there anymore. And I also want to talk just a little bit about the fact that, you know, as much as we try to have universal health care, we still don't have universal health care, unfortunately, in this country. And so I just want to talk just a little bit. It isn't about being, I'm not for abortion. Do I honk if I see a sign that says honk if you're for choice? Yeah, I do honk. We've been very lucky and very fortunate in my family and in my own personal experience, even when we were pretty poor, to have access to health care for my wife, because there were people out there that were giving that kind of access. And I just want to end not by trying to have it, I mean, to kind of say that we're for Planned Parenthood because we receive money. I think it's a little just under the belt. This is really about women and about what's the law. So just 2 last points. There seems to be a question here of morality. And I just want to say that, look, when you have members of the House of Representatives proposing DOMA that have been divorced 4 times, I think we might want to question their knowledge or their sincerity about marriage. Of course, that was overturned by the Supreme Court. When we have clerks that are married once, twice, 3, and then all of a sudden get religion and say, well, I'm not going to give a marriage certificate to those 2 men or those 2 women because it's a case of morality, maybe I might want to question people's morality. But in the end, what you cannot question is this congressman's right to defend his 2 daughters' rights. I raised them. I gave them the best I could, and I trust them. And I'm going to protect their right and the right of every other woman to make decisions about their reproductive systems with their conscience. I raised them, I gave them the best values and the best I could do, and I need to respect them now. And I just wish that in this society, we would have a system that respected all women and the kinds of decisions that they have to make every day. Every day they have to make decisions. And I don't think we're in a position to judge them. And I'm certainly not going to allow others to promote legislation or to promote situations that put that in jeopardy. Thank you so much, Mr. Chairman.